Hi, everyone, and welcome to our newest venture here at Bloom Facial Plastic Surgery, and that is the Beauty in Bloom podcast. This is going to be exciting. This is a new venture and something we really haven't delved into before, but the idea of podcasting about things that we talk about on a daily basis in our office was really the idea behind this. And all of the episodes are going to be hosted by myself, Dr. Jason Bloom, and our three fantastic nurse injectors. We have Lily Marquez, Sarah Houchins, and Simone Talmore. And I'll let them each introduce themselves. We'll talk a little bit more, but each of the different episodes that we have are going to be based on things we talk about in the aesthetics industries, maybe new hot viral trends that are going on, whether we believe them. But this isn't sponsored by anyone. This is just something we're doing for education and fun to get our views out about these different topics. So with that, I'll introduce our three nurse injectors, and starting with Sarah Houchins. Sarah is our director of Injectables and our lead injector here at Bloom Facial Plastic Surgery. So Sarah, tell me, how did you get into the aesthetics industry? How did you end up here? What were you doing before this?
So I started in the hospital, like pretty much every other nurse, well, most nurses. I was working surgical trauma, and then I moved more towards a little bit less scary hospital nursing. So I was doing surgery, post-surgical things, but just not the trauma side of it. And then I met a plastic surgeon. I took care of one of her patients at the time, and she said, "Oh, you took such great care of my patient. Would you ever have a desire to get into plastics?" So I started working in a plastics office, and then the owner of the practice wound up retiring. And then that's when I slid into your DMs and asked you if you were looking for an injector.
Yes, I was starting a new practice at that time. That was probably 2019. I was, leaving my previous practice, starting a new practice on my own, and I wanted some good nurses to help out from the injectable aspect of it.
Yeah, and I was looking to inject more because I was working in the operating room as well as injecting on the days that I wasn't. So it was good to kind of get into a role where I was doing more of what I really wanted to do.
Right. So, I mean, your Instagram handle is Scalpels and Syringes. Do you ever wish that you were back in the operating room? Do you ever miss that part of your previous career?
I miss all the anatomy, and I miss all of the you kind of get to see a whole transformation in a few hours. And I definitely miss that aspect of it, but I do like the autonomy, and I like you're not a micromanager. So I love how I can kind of be my own, not my own boss, but you know what I mean.
Yeah. So like your time is your own. You can, I have you guys working as much as you want and doing kind of what you want.
Traveling the world.
We love that. Yeah, we love that about you.
Well, Lily Marquez was actually, she started out as a different role in our office and has now kind of ascended to be a nurse. And so, Lily, tell us about your story a little bit.
I kind of done it all. I started out as a front desk. So I was working front desk at a med spa. And then I slowly started getting interested into aesthetics. So then they actually offered to pay for me to go to aesthetic school. So I went to aesthetic school. Then I started practicing as an esthetician. And right about when you opened up the practice was when I decided to go back to nursing school. So I remember interviewing with you, and I really wanted to get into injecting. And I was like, if I come work for you, I would love to have you train me to inject. And you're like, well, who better to train you than myself? So I was sold. So, then I started working for you about 6 years ago. And then, I graduated nursing school about 3 years ago.
Yeah, so you started as an esthetician at our office,
Yes. Yeah.
and working, part-time. You were doing a couple days here,
Mhm.
and I like to kind of take on like one project. I knew when Sarah came aboard, she had more experience with
Yes.
injecting, and I kind of wanted you to be the project to kind of show you what we've been doing. And once you became a nurse,
Mhm.
you kind of took that and ran with it, and
Yeah.
then took a lot of your aesthetics patients that you were seeing as an esthetician and turned them into your injectables patients, which was great.
Yeah, it was awesome because I can offer the skin treatments and I can also offer the injectables as well. So it kind of goes hand in hand, but it's really fun.
That's awesome. And then came Simone. So Simone, tell us your road in aesthetics. Where did you start? How did you end up working at this practice? Tell me a little bit about your story.
Well, I also slid into your DMs.
Girl.
I didn't know that I was unique. Okay, so I worked in the surgical trauma ICU, realized adults was not my thing, and I did neonatal ICU. I was dating a guy in New York, so I did travel nursing, and I was over the hospital setting like Sarah was. So I emailed like 20 plastic surgeons that I Googled, and I just copied and pasted my little short snippet of I have a surgery background. I'm really interested in plastic surgery. And one of the 20 emailed me back, set up an interview, and they were like, great, you're going to be in the OR, and we're also going to teach you Botox fillers and lasers. I was like, what the hell? I don't know anything, but sure, sounds great. And little did I know I would fall in love with this world. So that was kind of where it started. And I ended up fully leaving the hospital world and just going right into plastics and aesthetics. And then I kind of did my own thing for a little bit. I just kind of took on my own patients in Philadelphia, realized how lonely it is to be kind of your own person, know people to kind of jump ideas off of. So I got really lucky. I just sent you a message because you've always been so sweet when I've asked questions about certain surgeries, if my patients would be candidates for it. And I was like, hey, if you're ever, hiring another injector, think of me. And you were like, how did you know? And that was it. It was amazing. I hit the jackpot.
Yeah, it can be definitely lonely out there. And for nurses and PAs who are, maybe open their own practice or who are out there, many don't have medical directors who are even, in aesthetics or let alone a plastic surgeon. It can be lonely and like you're out there on an island, right?
Totally.
And so I, for years, have kind of, reached out in the community to other injectors and said, listen, if you run into trouble, please feel free to call me for issues. And, it's good to be good to people. And that's what I've always said is it's really important. And I've really built my practice on a lot of the community outreach I do in terms of the aesthetics community. Mm-hmm. So I do a lot of education, as you guys know, yes. In our community and, throughout the country. And that has also helped my surgical practice, certainly. I've kind of grown a lot of what I do surgically based on referrals from, even you guys before you were working for me. And so I think that's been really, helpful for my practice. Before we go a little bit further, I'll tell you a little bit about my story. So I am a facial plastic surgeon. I trained at Penn and did my residency there in otolaryngology, head and neck surgery. Following that, I went to NYU and learned a lot of the techniques that I use today in the operating room during my fellowship. My residency was very, very heavy in head and neck cancer and reconstruction of those kind of things. And the basis of head and neck anatomy was really, I mean, I still use everything I learned during my residency in the operating room today, and understanding the nose, the neck, the, face, the jawline, all those things. I mean, like we're dissecting them for, tumors and cancers and reconstructing them. And so that really helped me, that knowledge of the facial and neck anatomy during my residency. And then I got to see the aesthetic side of it very, very, on a very high level when I was at NYU. And I came back to this area, and I actually worked for a laser dermatologist for like 7 years. And we used to joke, I did everything that caused blood or smoke in the office. So all the ablative lasers, all the surgery, and then all the injectables. Actually, he didn't do any injectables. And it just became to the point where I was running a pretty busy facial plastics practice out of a derm office. And I wasn't getting any of just the stuff that gives you gray hairs. I wasn't getting any support. Like I was booking my own patients and calling the ORs and doing all the stuff that now we have a team to do, but it was really making me, it was actually killing me from the inside. And so when I finally decided to leave and open up my own practice, I gave, all the notice to help that person bring in a new person in his office. And that's when I started contacting you guys, because I needed a team to help me and kind of move forward with my vision. I will say one of the things I love the most about my job is the camaraderie that we have both in the office and in the operating room. Like Simone, like you were saying, it's hard to be out there by yourself when, you have questions, you don't know what's going on, and to have that team approach to things like we have, that makes it kind of just more relaxing, easier, and it's a great place to come to work, which is, I think, one of the most important things.
It is.
And the other thing is, I love being a mentor to certainly you guys, where I get to have you in my practice, but also to residents and fellows. I'm one of the co-directors of the Penn Facial Plastic Surgery Fellowship Program. I have appointments at Penn in facial plastic surgery and ENT, and now in plastic surgery. So I work with those residents.
Which is huge.
Yeah, it's great. I get to see the residents, and actually one of the cool things is I get to see who's good, who I get along with, who I can't stand in the operating room. And then I also have an appointment in dermatology. I say I'm not a dermatologist, but I am by association. I used to do a lot more injectables. Now I've handed off a lot of my injectables practice to you guys. And, I say I don't take new patients for injectables, but I still have some patients who want me to do their, injectables for some reason. But I've been doing less and less, but I still love teaching it. I love when the residents get that understanding and something clicks. I was actually with the residents last night teaching injectables. I go down to the hospital and they have an aesthetics night. So I have an appointment in dermatology at Temple University, and I teach the derm residents, which is these are all the things that kind of get me excited about doing what I do.
Yeah, I feel like I have to say, and I feel like I'm speaking for all of us, coming from working in many, many different offices, this office is by far the best. Everybody gets along. And I feel like in 6 years, we've not had one person leave besides to go to medical school. You've had no turnover, and every patient
won't fire anyone.
Well, exactly. We have great job security.
Don't give anyone any ideas.
Every patient comes in and they say, I feel like this is a great place to work. Is he really as nice as what he seems? And it's nice just to say yes and not have to hold back tears and lie through your teeth and be like,
yeah, swallow your pride.
Yeah. No, it's true. It's such a great place to work, and it just speaks volumes about how happy your staff is. And I tell everybody, if this is your first job, it sucks because, you know, it's all downhill from here. This is like the best place to work. So we're in it for the long haul.
Yep.
But
Yeah.
all the newbies, I'm like,
We've
oh,
all been
sorry.
properly hazed before we got
Yes.
Fun.
Yes.
Yeah, I mean, I will say I have never had to like everyone that's like left this office has either gone to medical school, gone to PA school, done something better, and you know that's what they want to do. And I'm always like that. You know, I'm more than happy to send someone off to that next level.
Yeah.
You know, gone to the job they've always wanted to, going to nursing school. So all those things are great, and it's nice to not, you know, I've found good people, and you know, like I said at the beginning, if you're good to people, that'll come back to you. So
I'd really like to know though, like what taught you to be such a good leader? Because like Lily said, we've all had really bad managers, and unicorns exist.
They do.
you know what? I was an employee for, like I said, for 7 years. And I went through a lot of the things that, you know, that I learned from, and I changed in being, you know, in having a partner, in working with another facial plastic surgeon, Dr. Strax at the office. And, you know, I went through all the things, and I knew how it felt to be on the other side.
Mm-hmm.
And when you take care of people up front, and those issues don't exist when you start off on the right foot and treat people right from the beginning, then you don't run into a lot of those issues that happen after the fact.
True.
So, sorry, with that, let's kind of, let's move to another topic, which is all the people out there who want to be in your position, right? Who want to get into the aesthetics industry. What advice, first of all, do you have for those people, either good or bad, or and then also, what's it like really, you know, working in this industry? You know, because everyone thinks it's all roses and rainbows, like fantastic, right? But what's it really like being in aesthetics, and how hard do you have to work to learn, to stay relevant, all those kind of things? So let's start out with, what advice do you have? And Lily, maybe start with you. What advice do you have for someone who's looking to get into the aesthetics industry?
Oh God. Just, you're not above anything, I would say. You know, go in, hand in your resume, and just offer to do anything. I mean, I was younger, but I started out as a front desk so I could learn the industry. Offer to work part-time, try to shadow people. It's a very competitive industry. And I feel that some people come into the industry now thinking that they're just going to have a full book and everything's, you know, going to be blissful. And it's not. It's tough. You're building your own book, and you have to really work and market yourself, and nothing's given to you. And I feel that a younger generation wants things handed to them. And, you know, we've all put in our dues. We've all been hazed. So it's hard to build a book, and you're not just going to walk in and, like, social media makes it look like, you know, it's not all glamorous. You're not going to be making a ton of money immediately. You know, you have to put in your dues.
I love that when a nurse like sends me a message or calls and says, you know, I want to be a nurse injector. Can I come work for you?
I took a weekend course.
Right. And I say, okay, so let me get this right.
You want me
I'm going to
train
pay you for me to train you to do what these nurses have worked for a long time. Mm-hmm. And like, for example, for you were working as an esthetician, mm-hmm. and on your, you know, at part-time, you're working like 3 days a week. Mm-hmm. And on the other 2 days, you were shadowing, and we weren't paying you. You were shadowing to learn what it was like.
And going to nursing
and
school.
going to nursing school during that time.
Yeah.
So like, that's the kind of energy that we want, to get into this industry. Yeah. Sarah, what kind of advice do you have for maybe a nurse that's starting out?
Well, I don't know if you remember, but when I interviewed with you, you said, I have no money to pay you. You are going to be paid off of, you know, you're going to you're going to eat what you kill.
Yeah.
And I said, okay, sign me up. Because I had a feeling.
That just talks a little bit about your previous experiences.
Yeah, yes.
Maybe it wasn't great.
Well, and I remember you said to me, I don't hire people based on their resumes. I hire people off of a feeling that they give me. And you said, I just have a feeling about you. And no one had ever said that to me in my entire career. No one, had ever put that amount of faith in me. And I also think that's why we have such a good relationship, because you recognize something in me and I kind of recognize something in you that, you weren't going to have this crazy booming office right away. And I wasn't going to have a big book right away. But we I think it was just a really organic, pure place for both of us to start.
Yeah.
It was new for you. It was new for me, but it worked out. And I mean, I did take a really big pay cut initially to come work for you. And I sat here, I would have a patient at 9 and I would have a patient at 5 and I would have nothing to do in between. And all those hours were unpaid hours. But like Lily said, you just can't be above doing certain things. It's not going to be all glamour and glitz right when you start.
And in between, if for example, if I had patients and I was seeing injectables patients back then, you would come in the room and suck up all of that information.
And you blow my mind every time.
Just learning what we do, because then when you had your own patients coming in, that you could take that knowledge and move forward.
Exactly.
So Simone, let's say a nurse that was in your position, she's in the neuro ICU and she's like, oh my gosh, I follow you on Instagram, Simone. You seem like you've got it all together.
Keep going.
How can I
Words of affirmation.
what you're doing?
I get that question all the time from all of the hospitals that I've worked in, the nurses.
Yeah.
On Instagram, people message. First off, Dr. Bloom did not tell me that he had a feeling about me.
I had a feeling about you, Simone.
I still don't know if I was like, about you.
He's like, I saw your Instagram and your patients look normal. They don't look overdone.
Well, that was a big thing, right? First of all,
social media is crazy.
Sometimes patients don't want to go to injectors who look overdone because they don't want to look that way.
Right.
And your aesthetic has to match.
Totally. It's like when you get your hair done and the girl comes out to grab you and she's got blue spiked hair. You're like, I think I'll pass.
Yeah, exactly.
No, just me.
Red flag.
I'd walk out.
So people would ask me all the time. It's funny though that you say that why would I hire someone that doesn't have any experience? I can pay them to teach them, because actually that's usually what I tell people is don't waste your money on these extremely expensive 101, gonna just teach you on label injections. You're gonna spend a lot of money. You're gonna put it on your resume. And every med spa, because I used to hire at other med spas, I'd look at that and go, great, you had 48 hours of probably injecting 5 people. Good for you.
Not even. Normally it's 2.
I tell them that's a waste of your money. I say you should try to get your foot in the door at a plastic surgery office, whether it is front desk, shadowing, being a medical assistant, because I do feel like plastic surgeons, and correct me if I'm wrong, you can mold them then in any way you want. So you could mold Lily, whereas I came in with almost 10 years of experience and I was like, bitch, I'm going to do it my way. But teach me your way.
Yeah. Tell me, Sarah, what do you think is the biggest misconception about working in the aesthetics industry? What is something that, you have been in this industry now for a while, and, what's it really like? What is different than maybe people would see outwardly in what they're seeing on your social media or when they see it in the office? But what's it really like, or what's a huge misconception that people don't get to see?
I think not a misconception, but the thing that people don't get to see is the part of it where you're dealing with difficult, unsatisfied, unhappy, unrealistic patients. So there have been times where it's easier to refund someone than it is to go back and forth with them for weeks or days, months, whatever. I mean, there have been a lot of times where I've kind of tucked my tail between my legs and did not want to refund someone, but it's the lesser of two evils. I mean, there are people who will literally come in and say, I look great, but I don't look like this person in a magazine. I had a patient say that to me, and it's not realistic. So I think it's really hard to kind of weed out the unrealistic patients, especially when you're hungry for business. But the further you get into your role, the further you get into your career, it's a lot easier to recognize this person as a red flag. I don't want to take them on as a patient. And that's kind of what nurses aren't used to doing. We're not used to saying, I'm refusing to care for you, because, our job as a nurse is to care for everyone. So it's tough.
Totally. I mean, I will say one of the biggest changes that I've made in my practice, even from a surgical standpoint, is I've learned how to counsel patients better and be more realistic about, like outcomes and things like that. Because if you set realistic outcomes and realistic expectations from the get-go, I think it helps. And it's interesting. I have patients come in, let's say, and, rhinoplasty is one of those things where it's a really... it's probably one of the most difficult operations we do. And it's actually the only operation where we do like computer imaging. And I have patients come in, I image them from the side, they have a bump and we're taking it down. And they say, well, can you promise me it's going to look like this picture? And I say to them, you know what? Now I say this to everyone, so I know I said it to you. I say, I can make you two promises. And the first promise is there will be asymmetries that you see with your nose. And the second promise is there will be irregularities that you see and feel with your nose. And they stand there like, what? How is there going to be? And if you want perfection, you're not a good candidate for surgery.
Yeah.
I don't even take on a surgical case, for example, with a rhinoplasty, if I don't think I can make the nose look at least 80% better. And if they're comfortable, and I tell them, I can make your nose with good certainty look at least 80% better, I'm going to shoot for 100%. But if you're comfortable with 80%, you're a great candidate. And, you have to realize, and I do this all the time, I said, this is what's doing it. It's my hands, right? It's not a computer. It's not a robot. This is what's doing the surgery. It's my hands. There's nothing magical about them.
Wow.
We're all human.
Yeah.
Right. And so, it's over this time, I would say it's learning how to talk to patients and adjust expectations more correctly. That's the biggest change that I've had with my practice.
I feel like you make us feel comfortable saying no, though.
Yeah.
I tell patients all the time, I've never heard the word sales goal or quota or anything like that.
And we never talk about that.
No.
Which is a huge difference.
It's
I do
know
work
what you
for other
pay.
med
No.
spas.
And,
Like, you don't even know
But
what my
patients
salary
are
was
shocked.
last year.
Yeah. Patients are
Other
shocked
people are
when they
gonna
hear
hear
that.
this.
Yeah.
And you'll be surprised.
No, patients are shocked. And I tell them, I say, look, I'm losing money by telling you no, but if their expectations after an hour consultation and they're still not understanding what I'm saying, I just say, you know what, maybe you need to go home and think about this. Maybe you should talk to a doctor about surgery, but you make us feel very comfortable to say no. We never feel that we're going to get in trouble because at the end of the day, we don't want that hassle. We don't want to have to refund somebody. And if they're showing you something on Instagram that's clearly AI or edited, it's not worth it to us.
But that also comes with experience, being able to say
Yes.
no. Because I remember in the first few years,
I was so
always wanted
scared to
say
say
yes.
no.
Because
Yeah.
I felt like by saying no meant that I didn't know how to do it. And now I realize by saying no, it's because I know if I do anything, it'll actually make it worse.
And it's not
or
worth
I
the
would
money.
better.
I would rather sleep at night.
Yeah.
Right.
Yeah.
One of the other things I've always encouraged you guys to do is, there's two kind of patients. There's one that comes in and they start by saying things like, in certain lights.
Yes.
And it's just like,
the mirror.
Yeah. And and I'm like, well, guess what? If I can't see it in this light here, you don't want me correcting it because I'm going in blind, right? If I can't see what you're talking about, but if I do see what they're talking about, they want a little touch up, they need some more. I've always said, what? Go in there, open up another syringe,
Make them
give it to them,
happy.
Yeah,
make
them
the
happy.
patient happy.
Mhm.
That's our number one goal. Make them happy. I don't care what it costs.
Safely though.
Yes.
Make them. Our number one goal is to safely make them
Yes.
happy, of
Totally.
course.
But I mean, I'm like, just do it. I would rather,
Yes.
open up another syringe and eat that syringe cost
Mhm.
and make the patient happy than to go back and forth about, oh gosh, I still see a line here. It's
Mhm.
not worth it.
it's not.
Exactly. No.
Yeah.
And you did say to me when I first started, you'll never regret the ones who you don't inject.
Totally.
And I was like, what? I had to think about that for a minute. And then I let it marinate, and it is so true.
I mean, we say that all the time with
It is so
surgery. You
true.
never regret the surgeries you pass on.
Mhm.
Yeah,
you
you
did it
should
for a
never do it
reason.
for the money. It's it's
I've always said, like, I always picture my mom, my sister, my brother sitting in my chair,
Mhm.
and would I say yes to them regarding whatever the patient's asking me? And if my answer is no, then that's the answer for the patient. I always treat them like they're a family member. So,
that's
did
great.
that make sense?
Yeah.
Total.
It
It makes
did.
sense to me.
Yeah.
Oh, Bloom was giving me kind of a, huh?
Do I normally give you that look sometimes?
Yes, that's
I've
actually
got
true.
suns in his eyes too.
So, throughout this, podcast, we're going to discuss a bunch of different topics in the aesthetics industry and skincare and hot trends and surgery. And we're going to have a bunch of exciting guests joining us on these throughout this podcasting journey that we're about to take. But let's have a couple like rapid fire questions, I think, that are good. So I'll kind of go down the line and we'll start with different people. But number one, if you could only use one skincare product for the rest of your life, Lily, tell me, what would that product be? And I'm happy to answer these questions too.
Sunscreen.
Sarah?
Anything with Trihex in it.
So the Elastin products, Trihex.
Mhm.
Okay.
A tinted SPF.
All right. I'm an Elastin Skin Nectar kind of person. So
Trihex.
that's my go-to. I
Mhm.
think that's that is probably I use a few things.
Products you use.
But what kind of products do I use? I use that. I use Skin Better Solo Hydrating Defense, the men's. It's like men, we want like one product that's real
Yes.
easy.
Yeah, a
So,
5-in-1.
Yeah, exactly. That's like easy for me, and I use Nectar. Those are my two go-tos. All right, Botox or Dysport?
Dysport.
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 Yeah,
100%.
it's interesting. I started out my practice. I was probably about 80% Botox.
I think we were close to 85.
Yeah, we were doing a lot of Botox.
Mhm.
Now, I think we've totally flipped the switch,
Yeah.
and we're about 85%
Yeah.
Dysport in my practice. You guys do my injectables. I think Sarah does my Dysport. I'm a Dysport guy.
Yeah.
Okay.
That's actually what I learned on 2015 was Dysport. So I've always been a Galderma girl.
Favorite treatment to do and to receive?
Oh, God. Favorite treatment to do, I would have to say lasers, like Halo. I love to do laser treatments.
Love that.
To receive, I like to do microneedling on myself. That's like my go-to. Yeah.
Sarah?
Sculptra for sure.
To do or to receive or both?
Both.
Cool.
I'm a devout Sculptra lover.
Well, we'll be talking about Sculptra a little bit on for future podcasts, so that's great. That's one of my favorite treatments as well. But
I would say a liquid rhino. So filler, rhinoplasty.
That's a good one.
Dr. Bloom did my nose and I'm pretty sure I cried. And I
with
think it's
filler.
yeah,
Yes, with filler.
Yes. Maybe one day surgical.
You're trying it out.
Yeah. Trying it out. That's the thing. You can kind of in a way try it out to some degree.
If
but
you're the right candidate.
yes,
for sure.
yes, for sure. But I just feel like, it's such a rewarding feeling when someone comes to me and they've been made fun of their entire life because of a bump they have on their nose. And then I am able to take it away with a little bit of filler and they just start crying in my room. It's so rewarding. Favorite treatment to get, something that feels nice.
I know, a sky massage.
Like, honestly, a hydrofacial, Lily's cringing, not because I actually like the results, because I like the way it feels. I don't like to be in pain, but if it was actually like I would endure pain, probably like a halo treatment
That's
once a year.
acceptable.
But fluffy is nice.
I mean, surgically favorite, treatments. I used to, if you asked me about 5 years ago, you would probably say rhinoplasty was my favorite surgery. Now it's probably eyelid surgery. It's one of my favorite surgery, upper and lower eyelid surgery, with fat grafting that's probably my favorite procedure to do.
What about injectables?
Injectables?
No, just kidding.
Lips?
No, I actually, that's probably my least favorite injectable to do is lips. I do like doing Sculptra a lot. I do like doing mid-face filler a lot. To receive, I haven't had too many. I will say the best procedure that I've ever received was a hair transplant probably about a year and a half ago, which was amazing. And
Zoom in on that hair.
Yeah.
Zoom in on that.
Show those before and after.
We definitely have to do, and we will do a podcast about hair and all the stuff that goes into it. That'll be a great episode. But that was my favorite, treatment I've ever receivreceived.
Wait, hold on. Facial type treatment.
I would say I haven't done a lot of stuff. I would say probably I agree with you, like microneedling or a hydrofacial.
Because you're a man.
I'm the worst to like.
He's the worst to get in the chair. Yeah.
But when I do, I think like a nice hydrofacial or microneedling is kind of relaxing. So I'm down with that. And then one other thing. So tell me, what is something that you think patients are wasting their money on?
Oh God. Like the 20-step skincare regimens. You don't need to buy every product that you see on TikTok and in Sephora. You're spending thousands of dollars when you could spend money on a good retinol and a good vitamin C and you're good to go.
Sarah, what do you think?
What are people wasting money on?
You just got to pick one.
I think the procedure that is the most the biggest pain to kind of undo is tear trough filler, under eye filler. So we see so many people in this practice who have bags, under eye bags, and I'm never, ever the person in a room to suggest under eye filler to not even the most perfect candidate ever, because it's very problematic, more so than any other treatment. And there are injectors out there who are saying, oh, let me just try to do a little bit of tear trough filler to blend, to conceal, to camouflage. It doesn't work that way. And once you have filler in your under eyes, even once you think it's dissolved, usually it's not. And it's such a waste of money to not only pay for that treatment, but then come somewhere like here and have to pay to dissolve it. And it's not a one and done. Like, let's dissolve it once and, it magically goes away. It messes with your lymphatics. It messes with swelling. I mean, it's just a nightmare and a half to manage. And I could talk about this all night.
Yeah, it's interesting because I was involved as the independent photo reviewer on the tear trough study for Restylane Eyelight. And so I used to do a decent amount of tear trough filler. And if you look at my practice, I mean, there's no question that infraorbital hollow filler is the most commonly reduced. I mean, and dissolved anywhere. And certainly I just do so much eyelid surgery that I would say now 75% of the patients who would get eyelid surgery, I have to dissolve filler preoperatively on. So I can't tell you when the last time I've done eyelid filler. I think it has a place for someone who, wants to kind of bridge to surgery and they realize that this is going to have to go away at some point if they decide to have surgery. But no, I mean, that has been a huge change in my practice, at least things I was doing, 5-6 years ago to now.
I mean, so I agree with Sarah that tear trough filler is usually not the answer, but you told me I was a good candidate for a lower bleph, and I was not open to it at the time. I mean, still am not. And you did under eye filler on me, and it looks amazing. And that's
So, yeah,
been like
There's definitely a
2
place
years.
for it.
There's
But I
a
think
Totally
yeah.
is. I won't disagree with that. I just think
Well, I think that we're lucky that we have 2 plastic surgeons we can refer to and just say, spend the money on the bleph, because in the long run, it's just going to make you happier. So
Simone, what do you think patients are wasting money on?
God, there's so many to choose from.
Mm.
That's a hard one on the spot. I mean, the first thing I think that comes to mind is just people listening to TikTok influencers about skincare products that, cost hundreds of dollars. We can go into certain types of treatments that I don't agree with, but maybe on a different episode.
All right. For me, I think non-invasive treatments on the neck
I knew
are like way, like I just tell people that,
I don't know.
it's for me to do this for you. It doesn't make any sense. I would rather you like get ready in your head to do a neck lift or a lower face lift or something to treat. But it is non-invasive treatments on the neck are just not worth the money in my mind.
they come in and they go, I want to look like this. And you're like, okay, that's surgery.
But we do a lot of Morpheus and soft wave on faces, and we typically throw in the neck. So, okay, if you get improvement in your neck, great. If you
And on
don't-
certain candidates, if they don't have the loose skin, but normally there's a lot more that goes into it, but the neck is the hardest area to treat. And I tell them, the amount of money you're going to spend doing non-invasive, eventually it's going to equal the cost of surgery. So just go get the surgery.
Thank you so much for listening to us on this podcast today. This is an exciting new endeavor for us. Please make sure you subscribe, like, follow us, and share all the things we've been saying here. And in the future, make sure you let your beauty bloom.